my name is Angie Shin, and I'm a product manager at Luma Health. With the recent authorization for emergency use of the first COVID-19 vaccines, Luma Health's COVID-19 operations plan helps clinics and health systems operationalize vaccine deployment efforts while staying committed to making it as safe and easy as possible for patients to get the care they need. In facing the influx of patients reaching out to ask about the vaccine, you can use broadcasts to message large groups of patient populations with announcements such as when you've received a delivery of the vaccine or where patients can go to always get the most up to date information without calling in. You can also set up auto replies so that whenever a patient sends a message that contains keywords such as COVID, vaccine, or Pfizer, the message can alert the appropriate team to follow up while also providing patients with an instant update. Once you're ready to start scheduling patients, you can send another broadcast to kick off your patients' vaccination journeys with screening and consent forms. These can be sent in an appointment reminder after scheduling or used to qualify or disqualify patients as part of a scheduling workflow. When a patient's first dose is scheduled, use a COVID vaccine specific reminder with the patient's appointment details, including any special instructions for the visit, such as minimal contact protocols and new vaccine specific check in processes. On the day of the appointment, once a patient replies arrived, you can easily move them through the vaccine intake process in the virtual waiting room while automated messages are sent in real time to keep them updated. You can quickly assess your capacity and address patients by their appointment or arrival time to ensure no one is ever left waiting too long. After a patient's first dose, it's important to follow up on how the patient is feeling. This can be sent automatically based on the number of days after the first dose. In preparation for a patient's second dose, if you haven't already scheduled the patient at the time of their first, you'll want to send the patient a reminder to schedule. This can also be sent automatically based on the number of days after the first dose. Finally, when the patient's second dose is scheduled, you'll need to provide the patient with all the necessary information as the first dose, but also make sure the patient understands the importance of the second to receive the full benefit of the vaccine. We're excited at Luma Health to support your efforts in helping patients get access to the new COVID vaccines.